Just a second. Okay, all right. Okay, thank you everyone for joining in. Thank you, Vishwa, Krishna, Arshia, Sajna. So I'll start with a brief round of introduction and what we're going to do today. So I am Sneha. I lead the business development at Glyphic. So what Aishwar and I, what we do is basically speak to NGOs, hold sessions like this for organizations to know how NGOs are creating impact through WhatsApp chatbot. So these are monthly webinars that keep happening just to share about how organizations are leveraging WhatsApp chatbot for their programs. So yeah, so we have Vishwa here. Would request Vishwa to introduce her, and yeah, go ahead.
Yeah. Hi everyone, and thanks Neha Aishwarya for inviting us to speak here. I'm Vishwa. I work as a senior manager in FMCH. It has been 3 years. I've been working with FMCH academically, a computer engineer, worked in 4 to 5 years in IT, and then switched to non-profit. My work and role revolves around most of the things that we do in tech and data. So we have couple of tech solutions that we use in house. So yeah, I mean that's about it, and here to speak about our journey that has been over 6 7 months. Yeah, about using the chat.
Thanks, Vishwa. Thank you so much. Okay, so there are people joining in. Would request you to just rename yourself, name and your organization name for us to know from which organization are you joining in. Okay. I'm going to start by sharing the slides for the day and the things that we're going to cover. Second. Okay, so over the registration, what we have seen is there are quite a few people who would want to know what WhatsApp chatbot is. So there are one or two intro slides to just tell you what Glyphic is and what chatbots are. So please bear with us, those who already know about it. Just be patient. We will cover this section and move on to the next. Then we have some insights from the bot that Sneha team has been running. So we will touch upon that. And then we'll hand it over to Vishwa to talk about how FMCH has been using their WhatsApp chatbot. And yeah, and then it's Q&A and demo of the platform, depending on the questions that we receive during the conversation. Okay, so people who have joined in, just wanted to understand if you can just type down in the chat box uh, or just raise your hand and can answer what are you looking forward to in today's session. Any questions, thoughts, or anything, we'll be happy to, try to include that in the discussions going forward. So any one or two responses be great. I saw someone in this question. No specific question for now, but excited to hear about the work. Thanks, Arshia. Okay, anyone else before we move forward? Okay, all right. But we do have a bunch of questions that we have received on the registration form. We'll pull up those towards the second half of our conversation today. But thank you so much for answering that, Arshia. Okay, so we'll just start by talking a little bit about what WhatsApp chatbots are, and what is Glyphic and what does Glyphic offers. The first thing that people who are new. So WhatsApp ecosystem has majorly three different kind of WhatsApp. So one is the app-based WhatsApp platform, which you have it on your phone, which is basic WhatsApp and WhatsApp Business. These are app-based, operated by one person at a time, and it's used for personal use or small businesses. It's one to many kind of a solution. Then the other one is WhatsApp chatbot, which is WhatsApp API. It's for reaching users at scale. It's many to many solution. Many of your team members can join in. It's platform based. Many team members can join the platform and automate the conversations that you already want to have with your users. And yeah, it's easy to configure, and it's easy to get started on WhatsApp Business API. So yeah, so that's the major difference between the two. What is a WhatsApp chatbot? It's basically a software application that helps you to automate your conversations. So if you already have a program running with your beneficiaries or end users, and you see there is a scope, there is a scope of automation. What I mean by that is basically you see that there's a repetitive task or repetitive thing that you're sending to your users. You can automate it and let the system handle it for you through implementing a WhatsApp chatbot solution for you. And what Glyphic is basically a WhatsApp chatbot builder. It gives you a platform to have a chatbot for your program. We have more than 100 plus organizations that are using Glyphic for running their different programs. Some of the organizations have more than one chatbot for multiple programs that they are running. So it totally depends on what kind of need you have, and if there's a need to automate, you can use Glyphic to set up your WhatsApp chatbot. We have quite a few NGO partners who are from the health space. This is just a slide for people to know, who are from people to understand some of the health partners that we're currently working with. But the list is longer than this one. But yeah, you can look at the names here and identify if you know of any. So. Okay, so now let's move on to getting a deep dive into the use cases. I'll hand over the mic to Aishwarya to talk about Sneha.
Hey everyone, thank you Sneha for that. Thank you Sneha for giving me the mic to talk about the organization Sneha. But yeah, Sneha is one of the biggest organizations in the health sector, um, who's basically working to improve the health benefits, or to create a healthy lifestyle for expectant mothers, pregnant women, before pregnancy and post pregnancy. Um, we all know the reality of pregnant women in urban and rural areas, where they find it very difficult to access any kind of um, health related information, or and there is a lot of myths around the urban and rural women, which has been passed on from generations, on what they are supposed to do when they are pregnant, and how they are supposed to take care of babies. But most of them are myths, like the name suggests. So Sneha wanted to address this, and their mission was to create a healthy environment, healthy world for mothers. So they work in partnership with communities and health systems to ensure that they create this kind of environment. So when they were doing this, they realized that they have some inadequate access to personalized, relevant, and comprehensive health information. And during the first few days of like basically the users, they understood that the users whom they're working with have lower literacy levels, and they need to get on ground to understand how they can basically help these users. Hence, chatbot came into picture, um, which actually is a very easy and convenient and chatbot through WhatsApp came into picture. So WhatsApp is an application that is used by all of them across regions, everywhere, because everyone has an access to phone. And that is when they came with an idea of chatbot. And we have a demo here of how the Sneha works. And when they introduced chatbot, they came up with a chatbot called Sneha Didi, basically. So Sneha Didi was like a friend and ally to pregnant women who gave a lot of information to expectant mothers, and also post-pregnancy on vaccinations, on nutrition, on food, and other things. Um, I'll just demo the bot for all of you to understand. Yes, Krishna.
Actually, we have a few team members from Sneha on the call, Clipsy, Nadeem. In case you want to add in something, please feel free to add anywhere. Sajana, Priya.
We are good, Krishna.
Yeah. Thanks, Clipsy, for joining.
Okay. So,
Sorry, you can go.
yeah. I'll just demo um, a small feature of the bot here. Just a second. Yeah, this is a small demo which gives information about Tikakaran, as in vaccination. So, demo is basically a keyword that we use to initiate the conversation. Once I say demo, then this is an AI enabled chatbot. Krishna, feel free to add in a few points since you have worked on the bot. If you have anything to say, please feel free to. And yeah, so once we say demo and we initiate the conversation, it will ask you, since it's an AI powered bot in English, it will ask you so that the users who are using the bot are more comfortable in understanding and using it.
Just to add to what Aishwarya said, so in Sneha's chatbot, what Glyphic and Sneha tried to do is we added all the information on immunization, social protection schemes which are related to the women who are in their pregnancy stage or in the first 1,000 days from conception to the kid up to 2 years of age, and different things on child care, nutrition, etc. We have added all that knowledge to the chatbot, and because it's a AI enabled, people can ask questions in the natural language in any language that they prefer. So, for example, because the current areas where this chatbot is in prevail, which is Bhiwandi region of Mumbai, there because people are more comfortable with Hindi or English sort of thing, so we use that as a language where we ask the bot to answer in that language. But you can do it in any language. Tomorrow, if you are doing it in Andhra Pradesh and if you want the bot to answer in Telugu and people will ask questions in Telugu, it will still work. And here, Aishwarya is typing a question on immunization. You can ask more questions on different topics which are related to the first 1,000 days of women, and which are the topics which we added the backend. And you can also ask question in as a voice note, because a lot of women are not very comfortable typing. So we added a feature where people can ask questions as a voice note and get answers also as a voice note. Yeah. Clipsy, feel free to add if I missed anything.
Okay. Thanks, Krishna, for that. So, like Krishna said, once we ask a question about immunization and vaccination that needs to be given, like as in, what is the kind of tika current that we need to give for a kid? Then, since it's an AI powered bot, and it is trying to fetch from the knowledge base that is uploaded on the backend, it takes a little time, and then it gives an information about. What is the kind of vaccination that needs to be given, and it also does not assume, so it can come up with follow-up questions to get more clarity on what is the age of the kid and other things, so it can give you a more relatable and accurate answer. So yeah, and also we have women who have been using the bot, and with they shared a lot of good testimonials of good stories of um, how they found the bot to be and how helpful it was. Krishna, do you want to talk about the testimonials?
Yeah. Uh, okay. So this is some stories that we have heard from Sneha team. Like you guys can also please add. Where we saw like one story where women had a issue like late in the night, and because she couldn't go to the hospital late in the night, so she asked the bot and she got the answer. Like she was in a pregnant stage and she got the answer, and she felt more relaxed and slept before she went to the doctor next day, like that level of anxiety which kind of like bot addressed in the first place, where it said like, hey, it's not something abnormal, so you don't need to worry much a lot. So that's something which we want to do, because where like women can start like feeling less anxious or like feeling more comfortable using something like a tech, or understanding like how their situations can be handled better. There's another thing like where I have spoken to few women who were using Sneha's chatbot, and one of the women told me like she trusts Sneha chatbot so much that before feeding any new food to her infant, she actually asks the bot, though she has a mother-in-law at home who suggests like what to eat and what not to eat. She's like कि मैं फिर cross check भी करती हूँ bot से, so that I feel better before feeding to my kid. So these are like small stories that might look like a smaller story, not like a bigger impact, but these are the behavioral changes, or these are the positive things that started happening in the community, and the trust started building more on using something like this. Yeah, over to you.
Yeah, thanks, Krishna, for that. Any questions so far? Any points to add, people from the Sneha team, or any questions so far? If you're not comfortable speaking out your questions, feel free to add it on the chat window as well, so we can address it going forward. So Sneha, next slide. So here we will hand over the mic to Vishwa from FMCH, who is going to throw some light upon the work that FMCH is doing, how it started, and the impactful stories that it has been able to create. Over to you, Vishwa.
Thanks, Ashwarya. Can I share my screen?
Sure.
Yeah. Yeah, so quite similar to what Sneha does, we at FMCH work on improving maternal and child health and in turn reducing malnutrition in the communities of India. As we know, 50-60% of the women in India are anemic, and 50% of the children are undernourished. And out of all the malnutrition that exists in India, 60 to 70% is preventable, and our focus is to work on this type of malnutrition. By preventable, what I mean is we work with the communities where there are resources. So it's not a poverty problem. these families have food in their home. What they lack is awareness and knowledge about what to eat and how to eat. For example, a family would prefer spending money to buy a packet of biscuit for the breakfast instead of spending the same amount of money to buy maybe an egg or a banana, which is also easily available in the community. So our focus is to empower this family so that the mother in the family make better food choices. In our direct model of intervention, which we've implemented in certain locations of Mumbai and Bangalore, there are three key elements. One is home-based counseling, where our own frontline workers goes into a field and they visit a family to family and counsel women using our own in-house built Android application, which is a decision tree application. Second, they also support Anganwadi workers who are community health worker in their monthly anthropometry. So they help them in accurately measure height and weight for the children. They also do a group education session where they do pregnancy club with pregnant women and lactation nutrition course for the mothers having 0 to 7 to 24 months children. So these are three key elements. This type of model is very well suited in the urban setting, in city like Mumbai, where the communities are very dense and health worker can visit at least 4 to 5 Anganwadis in a day. But in rural setting or in other geography of India, this model would not work. And even if we want to scale this model, we would need a lot of frontline workers. So this model is very costly and very resource heavy. That's when we started doing partnership with government. We have MOUs in certain districts in Madhya Pradesh and Karnataka where we partnered with ICDS system. We work with different stakeholders in the system, like Anganwadi workers, supervisors, CDPO, DPO. But among them, our most focus is mainly to work with Anganwadi workers, and we try to improve their ability to do their work the way our frontline worker does. To be able to reduce malnutrition, two focus area that we mainly focus is detection and counseling. As a part of detection, we help Anganwadi worker. We train them to better and to accurately measure height and weight for the children. For counseling, we have provided them a lighter version of our Nutri app, which is also a decision tree app. It helps them to counsel mothers. They don't have to remember what to tell to mother, and they can just follow the question answer coming on the application. But as we piloted this version of our intervention in certain location, we soon realized that we can't rely entirely on Anganwadi workers. Why? Because even if we train them, the machines are very poor. They are not able to accurately measure. Many a times their incentives are misaligned. So even if for the fact they know that I have in my community, maybe for example 4 to 5% SAMM children, they are told to report wrong number. In many districts we have also struggled in getting permissions to to for the usage of the Nutrilite app. And also Anganwadi worker is always overburdened. They have take home ration to distribute, EC activities, and many a time they are invited for the election duties, this and that. So that's when what we asked ourselves is, who in the entire ecosystem cares about the child the most? And the answer was mother. So we thought of giving the power back to the mother. And again, as we focus empowering mothers, we focused on this two element, detection and counseling. We distributed health indicator tape, which is an enhanced version of the MUEC tape. It's definitely not an accurate tool to measure malnutrition. It's a good proxy and easy approach to scale. And the second is counseling, which, as you all know, we have developed a chatbot using Glyphic as a platform, which mother can use at any point of time, whenever and wherever they need to seek information and guidance around their and their children's health and nutrition. And it also, in a way, reduces load on the Anganwadi. So the NutriBot, which we also call as Poshan Sakhi, it's available currently in 4 languages: English, Hindi, Marathi, and Kannada. It currently has conversational design. We have not integrated AI yet. We have typed different types of content. We have, for different topics, we have tried different types of content: investigative, story, quiz. We have integrated with Bhashini. So wherever we are, expecting users to type certain things, we have, done the integration with Bhashini and, reading those voice note and converting them into text and using on the backend. Wherever users are, not following the conversational structure and they ask random questions, we collect them as as tickets. And currently, FMCS staff respond to them on daily basis. So that's how we are currently, doing the uh, and we are handling open-ended questions, random questions that are being sent by the mothers on the bot. We have also tried certain reminders for monthly anthro, and also we have nudged during the nutrition month that gets celebrated during September. We have pushed certain topic-specific content to all users. As we have used, we have piloted, we have we have I think it has been 6 7 months since we started our board, and some of the major learnings that we have had is whenever a mother is high motivated, certain barrier gets overcome. But if the mother is not motivated, that engagement is very limited to whenever we are sharing the board. I mean, she'll be interested to use the board for a day or two, but then she'll either forget the board about and yeah, many of them, they lack the question, they don't know what to ask. uh, Users usually prefer images and videos and practical tips over maybe conceptual or preachy gyan. The other big learning was, many a times families have only one phone which is being shared by all the family members, and usually phone stays with the husband during the daytime and mother has access to the phone or even WhatsApp only at night. From all the content which we have added on our board, what we realized is recipe was the most valued and most accepted flow among all the mothers, where they actually tried the recipe, made, and actually used it to feed their children. Yeah, I mean, some of the basic numbers are currently we have 9K users onboarded across locations, across languages. The highest retention that we have that's reported was 88% during nutrition month, where we have sent 3 nudges to all the users in a month. And from all the content that we've developed, average content flow completion is 62%. And I mean, as we speak, we are still, working on our next version of the bot. Yeah, maybe I'll, try to demo the bot a little bit. Stop sharing. If I start the conversation with hi, the first message that come is, what do you want to talk about? If I select children. So yeah, I mean, it also gave images and
Okay, so now it is going into the recipe.
recipe. Yeah.
Okay, interesting.
Yeah. So yeah, I mean that's I think
Nice. Does it like show how to prepare? Oh, okay. It takes you to a YouTube video where
YouTube videos.
uh,
Yeah.
interesting. Okay. And
Yeah.
do users come back from after watching the YouTube video here? Like what happens after that?
Yeah, I mean, once they'll watch the video, they'll come back. I mean, recipe was as we have, we have been on the field multiple times, and recipe was the one that they actually look for. I mean, can you share more recipes? I think that's the different stories that we have heard from the field, and also it gives us insights around what are the major concerns when they are in their first 1,000 days journey. So
Very interesting. Thank you so much, Vishwa, for sharing that.
yeah.
Interesting to see how you take the users to recipe and then yeah, okay. Do you also have like a mechanism for where they try out the recipe and also share feedback with you on how it was? With respect
Not,
to trying. Yeah.
yeah, I mean, not really, but that's what we are thinking of, developing. I mean, closing that loop and actually, measuring the impact. I mean, like, even we are thinking of using the image recognition where, they can actually share the picture, feeding the child and all of. So, yeah, I mean, that's like as we speak, we are working on the next version of the bot. So, yeah.
Interesting. Very interesting. Thank you for sharing that. I do have a couple of questions
What?
for you, Vishwa.
Yeah,
Yeah,
sorry,
Krishna.
what's your sorry, is anybody else talking? Huh. So how do you like this is the bot completely on nutrition currently, right? Nutrition and child development.
Yeah, it's health and nutrition. Yeah. And
Health.
our focus is also like mostly first 1,000 days. So, yeah.
Oh, okay. And you
Hmm.
are focusing on nutrition piece right now, and probably you'll be expanding to other.
Yes. I mean, till now, so as I mentioned that our stable version of our intervention where frontline worker goes on field and they do the counseling, that's like a human counseling. So all those fundamentals only we have used here. But yeah, I mean, as we learn when we try to engage directly with beneficiary, because you don't have that human touch. So that's where where do you balance that out. I mean, something you will expect the Anganwadi worker to do, and something you will try to achieve via the bot. So that's where, uh, yeah.
Are you also thinking of a bot or something for Anganwadis or frontline workers in future? Like a bot
Not
to
at this point. Not at this point, but sometimes when we think maybe to train, I mean, maybe to, doing the training at scale,
uh-huh.
we might think of yeah, I mean, but currently I think our focus is more to to actually improve this bot so that we have that engagement, impact, all of those.
Nice.
Yeah.
Okay. All right. Thanks, Vishwa. Okay, so just wanted to understand from you, like you said currently the bot has a reach of 9,000 users, right? Just wanted to take a step back and wanted to understand how from the beginning, how did you think about implementing a WhatsApp chatbot? What are certain things, of certain platforms you've already explored, and why did you then move in a direction of using the bot?
Yeah, so we did think about the SMS and even a standalone application because we already have our own mobile application that's being used by our frontline worker. We thought about a different type where we can create a mother user type, but both of them we didn't concede. I mean, we didn't go ahead because one fact that we've realized during our, in direct intervention is, our videos, the tutorial videos and IC materials are the ones which are very appreciated by the mothers and which is not possible via, I mean, sending via an SMS. Second was, yeah, I mean, definitely, I mean, standalone app, it's like it requires additional downloads and also training of mothers. While we know that even in low income communities, WhatsApp is a easily and widespread medium being used by the people. Um, yeah, I mean, it requires minimal training for the mother to engage, right? And the reality that we have realized when our frontline worker goes on field, many times if mothers are working, they are not available during the daytime, and that's when I think that's using WhatsApp is an opportunity, because there they can use the content whenever they have time.
Yeah, yeah, I understand. I mean, there are advantages to using WhatsApp to an app, uh,
Hmm.
considering downloads and taking a user to external platform, uh, and then going through the entire registration process. But yeah, just also wanted to understand. So you mentioned that the scale is currently 9,000, right? What are your plans for next year? Where do you want to see the chatbot, and what are certain things that you plan to implement on the bot?
So I think at this point, earlier what we thought is, does it even work at scale? I mean, that's what I mean. Will we be able to even share the numbers with the mothers? That's what I think we have been testing. But right now, in the next version of the board, what we are more focusing on, maybe narrowing down the scope and actually seeing if it is making the impact. I mean, let's see if it is actually working, because that's it. I mean, we have heard stories, but I mean, and also it's we are currently at a very early stage where you can actually measure that malnutrition, like salmon percentage come hua hai ki nahi hua hai. So that's so we our focus would be maybe narrowing down a little and actually try to see how to make. And as we speak, when we started at that point, it was an election time and all of those were happening, and we thought it'll be a good idea to spread the number. We spread it. But now I think currently we are focusing on narrowing down a little, and also, as Krishna spoke, right? Maybe where we can integrate AI. That's also a thought. Maybe I mean, our learning is, I think it'll be a combination of rule based and AI, because many a times mothers don't know what they don't know. I mean, mothers don't know what question they should ask. So yeah.
Okay, got it, Vishwa. Okay, so no, narrowing down the scope, right?
Yeah.
If you can just share a bit about like what kind of impact that you're measuring through your chatbot that you have right now, other than the number of users, the reach of the chatbot, are there more
Huh.
things that you're able to track through the chatbot which you were not able to track through other channels in the beginning?
I So it has given us a lot of insights around mothers' information seeking behavior. Like we didn't know that, because there are like recipes are available on YouTube and at different other platform as well. But maybe coming from a bot, they feel it's from the trustworthy source. So, and that's it. I mean, it has given us a lot of insights around what mothers are seeking, what are their pressing challenges, and it's like a medium where they can share their voice. So, which earlier it was very ad hoc, which we listened to from the community workers, but that's how the data is helping us in how to make our current version. How to actually add certain new things, update new things. Yeah.
Got it. So basically more of like feedback collection, understanding how
Yes.
the program has been working and then tweaking it based on that.
Yeah.
Okay. That's good to know. Which I also wanted to understand, do you have any stories that you would like to share, like in particular, on the program, or any inspirational story from the ground, if you have any?
Yeah, I mean, we have been on field multiple times, and there are a lot of stories. Like many, mothers shared that earlier. I was struggling with breastfeeding, and then I saw your tutorial video, and it was also not, I was feeling shy to share this with doctor as well. But then I looked at the video and it helped me to improve my technique. So this time, and some other shared that earlier my child was not eating. फिर मैंने ये recipe आपका देखा and actually then मेरे बच्चे ने खाया. So yeah, I mean those kind of stories we have heard. Like they stopped giving junk food, सारे लोग बंद कर दिया. Now we have started making this, started using your recipe to feed our child. So I mean there are stories that definitely coming up, and it shows positive impact, positive behavior change. Yeah.
That is good to know. That is good to know. So how do you collect these stories? Do you through the bot, or is it there's an offline mechanism for you to collect these kind of stories?
Currently it has been offline by going to the field and speaking to the mothers, but again, yeah, I mean that's also a thought that we will be focusing how to standardize this story collection so that the data keeps coming to us.
Got it. Got it.
Yeah.
Okay. Okay. Okay, so we can also help you out there. I mean, if there's a way we can work with you to understand how can you
Sure.
collect stories through WhatsApp chatbot. Okay, so just one or two more questions, and then the questions which are there on the chat window too. Vishwa, just wanted to understand. So when you started the pilot, with the audience, with the target audience, what are certain things you kept in mind while working on a pilot, and what are certain considerations you had while initiating a WhatsApp chatbot pilot?
One was we were very much sure that when we started with text, we'll have limited reach, because we for sure we knew that many of our mothers, many of them only voice is their usage of WhatsApp. So that's the thing. Then even in terms of creating a content, how to make the message very crisp. It should not be a long. I mean, we know that time poverty is a fact for the women. They don't have time. So how to make that very easy, very crisp and actionable thing for them. And even when we started this AI and all of those, when and that's when the biggest thing that we have had on our head was our mothers don't know that what they need to know. And many a time they feel their child is unhealthy when they are sick. Until they fall sick, they think that the child is healthy, but that's not the case many a times.
Very interesting. Thank you, Vishwa. Okay, so we can take some questions from here. There's one question from Clipsy. Hi, Vishwa. Other than English, are there other languages embedded into your chatbot?
Yes, currently we have English, Hindi, Marathi, and Kannada.
Okay. Okay, Keshav has a broader question. Is there a scope for building a common annotated micro-learning content pool library? For instance, we are starting afresh and that will require a lot of...
Madam, share ಮಾಡ್ಬೇಕು ನೀವು.
Sorry, Keshav, can you just unmute yourself and just share the question that you have? It'd be great to understand in depth. Yeah.
Am I audible?
Yeah.
Yeah. So this question was also for the larger group. Like, I mean, many of us are like starting on this on-demand digital learning journey. And I think where we as an organization and from Antra Foundation have like hit a stone wall is that we need to like curate our content for the micro learning platforms, right? And that's this heavy lifting which a lot of us are doing. And I was trying to understand that why, let's say, Glyphix a technical platform which helps us in enabling dissemination. Are there enough platforms which help us in creating or curating that micro learning content as well, and annotate that so that we can lean on that common pool and then don't start from scratch?
Got it. So, not sure about the tools that are available there, but I mean, happy to patch you in with any of our existing organizations who have already, started the journey and already been there doing things for a longer time, right? And can help you figure out how you can get started with respect to your content also. So there are also organizations that look for partners with respect to NGO partnerships, and have like a chatbot that they can run in partnership too. So, but yeah, Keshav, we can speak more about this um, later if you're available. But yeah, Krishna, Ashwara, if you have more thoughts, please feel free to add.
No, I'm good.
Okay. Any more questions? Got it, Keshav. Okay, all right. No more questions from the audience. Vishwa, just one last question to you, which is, what is the one piece of advice you would like to give to any health NGO that's considering a WhatsApp chatbot for their programs?
Yeah, I think our biggest learning till now was, start small. Don't, create or build a lot of flows, I think. And also, many times when we think about product, we think that, we need to keep the end user on our mind. But here, maybe involve them. I mean, build with them, create a flow and, we go on field, take their feedback and actually, yeah, I mean, and be as agile as possible. Yeah, I mean, iterate rapidly. I feel that's the only advice. Yeah.
Got it. Thank you so much, Vishwa. We have Sneha team here as well. Would also like to
Yeah.
understand if they have any tips for any health organizations that want to start with their chatbot. Yeah, please, Clipsy, if you want to go ahead and
Yes. I think it's all about understanding language barriers, literacy levels of the women, the very first exposure to such kind of a digital platform, and then perhaps we could understand their pace, what are their comfort levels, what is it that they want, and what happens when one kind of just exhausts all the questions. अब मेरे पास कुछ भी नहीं है पूछने के लिए, you know. So we need to consider all of those concerns as well.
yeah,
I like to add it more to
yeah,
the
Nadeem.
Cripsy and Vishwa. Like Vishwa told, start with a small audience, understand what are the requirement and pilot it in a phase wise. So we started with the 400 beneficiary and then we started moving ahead like that way. And our pilot goes from pilot 1 to 3 and 4 and understand what we can integrate in the next stage and what we can integrate later on. Like that way, in a phase manner, we have went till AI integration. Krishna, you can add it more on that part also.
Yeah, so Sneha has like very clear 4 pilots. Like every pilot we learned something and then we jumped into something else. Now 4 pilots are done. Like we are yet to start 5th pilot, like with few more people, but still learning from our challenges that we faced in the past to see like, hey, what's working, what's not working, why it's not working, and then designing the next pilot to ensure that those are not happening at least. So, like, just take it in phases, and it will take time. This will be a learning curve for the team as well. But like once you crack it, it will be a really impactful and a helpful thing for your community.
I think one cautionary note with the chatbot in the health sector or even in the education sector, it's going to be too early for us to determine impact. Right now, we are only talking about behavior. We're just going to look at behavior. Ki how many mothers are asking questions, and what is it that stops them from asking questions? So for now, at least Neha is just focusing on help the mothers ask questions, help her to raise that question, help her to ask in the manner that she's comfortable. If she's not able to type, perhaps she could just text and ask a question. I think we are at that level at the moment. We are not at all delving now for to look at impact.
Yeah, like great point, Clipsy. Like it's a
Yeah.
long game. So just understand that it's a long game, especially when you want to uh like a long-term plan of Sneha is to ensure that there's a information seeking behavior that's coming in the women where they want to get into more healthy habits. They want to be an active partners in their 1,000 days journey, and like it's a very long-term impact, like long-term behavior change that we are trying to target. But at this point, like understand what's the behavior that you want to target. Like people coming and asking the questions. People are knowing how to ask questions. So just have those smaller goals for yourself and eventually build on to get your thing. Like on day one, nothing will happen. Like on the
Yeah.
beginning first year, nothing will happen.
Yes,
But
yes.
eventually it will happen, and that you will see the change.
Yeah. And we are happy Krishna and the Glyphic team has been helping us to fine tune, and to refine the processes. Yeah. But that was very helpful.
Thank you so much. Thank you so much, Clipsy and Nadeem, for your inputs. Okay, so we're almost towards the end. Just one or two more slides for people who are new here to understand the potential of where WhatsApp chatbot can help. I mean, what can WhatsApp chatbot do for their organization? So we just created the slide. This is just an idea slide for organizations to understand how can they use WhatsApp chatbot for their programs. You can send reminders on on medication, you on on health checkups and wellness activities. So basically the idea is to automate reminders or nudges that you send to users. You can also integrate it to your existing systems, which is your app, boost engagement of the app, put data onto your app. So those kind of integrations are also possible. You can run health surveys. So health surveys, so this organization, Arogya World, what they do is they run health diabetes prevention program on Glyphic. So how they do it is basically send people messages every week to understand how can they control their diabetes through basic questions on how can they control what they're going to eat and what they had this week. So behavioral nudges is something which is similar to what they're doing. Multi-language support, which we already saw how it's been done with FMCH. Yeah, why you should think about implementing Glyphic is helps you to gives you you start thinking about your impact. You start thinking about how you can check your impact. You're able to at least start measuring your impact through technology. You're able to reach a larger set of audience, and you're able to deliver information with larger set of people. And it also helps you to track how is the information being taken by the user. It helps in streamlining the operations, so basically automating the routine regular tasks. You can put FAQs, reminders, and track the progress, and also get feedback on the content you have just shared. So if you share a video, audio, you can also ask people to share a feedback, which can be as simple as thumbs up and thumbs down message on the content you have just shared. So those kind of things you can do and understand the effectiveness of the content that is being shared. So yeah, so I'll just stop here. And okay, we're almost on time. Just wanted to open up the floor if anyone has any more questions. I agree, Clipsy. I think having a 24/7 reliable information shared to a user, it's very important. And considering women and pregnant women and lactating women, it's an important piece of information that you can circulate. And yeah, most of the mothers are up in the night. So yeah.
Okay, so one question I had, Sneha, which was
Yeah.
more more to do with the is health the hook to start the bot with? And we have been debating a lot about it because let's call those some ice breaking flows, right? Where I mean, maybe not the first question will come on health, right? People would want to build that trust, and then you can start pushing out health related content. Uh, are there any ice breaking flows which folks are thinking of? We'd be really interested to know about that because, in our experience, health's probably not the first question people end up asking, even through a bot.
Okay. Okay.
Can I
Krishna,
take
you
this?
want to? Yeah. Please go
Yeah,
ahead.
yeah. So Keshav, like again, it depends on where you are. Like, I think it's knowing your users will be the ultimate answer. But I'll tell you what we are thinking at Sneha. So we at Sneha also be having discussion on this. Uh, Health might not be the first thing which people might want to ask, for sure. So we are also discussing on should we first to show value where we probably send nudges on the send nudges or reminders on when the vaccination date is due, or when their checkup is due, or what's the nearest vaccination center. That's one way which we are thinking. The other direction which we were thinking is shall we propose something on social protection schemes? Like, hey, you are eligible for this scheme, like where because they will get some monetary benefit through that, and which will also add value. But the counter argument to that is, will people start relating bot to money? So there are like multiple thoughts that we are also having. But yeah, it will be a great discussion point probably. Uh,
Keshav, also depends on, just adding on to Krishna, it also depends on what is the most asked question your user is asking you, and if you want to like possibly start from there. What is one or two challenges which the organization is facing, and you see WhatsApp chatbot can add, take off the load of the take out the manual load. So depends on what kind of questions, what kind of conversation. Also depends on if you want to automate your program. So totally your call, but happy to talk to you on what are certain kinds of challenges that you're already facing in your current system, and we can see uh, what can be the starting point for you in that particular case. Okay, so we're on time. Thank you so much, Vishwa, for joining in. Thank you so much, Clipsy, Sneha team, Nadeem, everyone at Sneha for just jumping in whenever we post a question to you. Really appreciate the engagement over the past 1 hour. Before we close out, I'll just ask Aishwarya if she can pull up the uh, feedback poll here, and would be great if you can just answer that and we can close out. So yeah, any last thoughts, any last questions, anything from anyone? Yes, Ina, we will share this right today. Okay, the poll is up. People can just respond to this. Okay, would request people on the call if you can just take some time to respond to the poll, would be really helpful. You can see one response. Okay, last 30 seconds and we'll just close it. Okay, all right. Thank you so much for your inputs on the feedback poll. And thank you for joining in today. And we hope to conduct similar session in future as well. Please join in. Thank you everyone for joining in today and sharing your inputs over the webinar.
Team, you people are really great. Thank you, everyone.
Thank you
Thanks,
so much.
everyone.
Thank you.